Hello, hello. All can see this? Those are check.
Yes, sir.
Hello. Okay. So shall I start now? Is the PPT visible to everyone now?
Visible, sir.
Okay. So today's session, we're going to speak about observation in infant case taking. Like what do things we need to observe during a case taking of an infant? So first, we need to inquire carefully into the circumstances just prior to the illness of the baby, like what had happened, then the baby fallen sick. What was the role of the fright of any punishment or anger or getting wet or due to cold wind exposure or due to chills or any foreign bodies onset or any food which has the baby has taken. So and even the what was the onset was gradual or sudden. So this thing has to be inquired very well during a case taking. Dr. Kadambari, is my video visible?
Yes, sir. Visible.
Okay. So now, after finishing the inquiry, use your eye to see how the baby is. Has the baby one side cheek red or pale, both cheek red? Uh, Examine the baby by touching his feet, one side hot, one side cold. Observe the baby, like what he does if the pillow is yellow with the sweat or even the socks are drenched in sweat. Does the baby drool? Are their lips are red or the anus is red? Examine them. Is there is puffiness over the eyes or in the mouth? There is a white deposits in the mouth. Does it chew like a ruminant or burrow the head in its pillow? If the child pillow burrows his head in the pillow, or even clench his fist like this with the arms in, thumbs in. So all the discharges you need to look with your eye. Now suppose you open the window so that draft of air blows to the baby, and if he coughs, you can think of Rumex, right? Draft of air aggravation, and you can think of Rumex. But if the baby stops coughing and he breathes easier, you would never give Rumex, right? So remedies you can think of like pulsatilla, open air amelioration. So you have to think this way. You need to observe like what is aggravating and what is ameliorating. Like you have to see if the child, kicking and uncovering the blanket. If the child is covered inside the blanket and is throwing up the blanket, or he's just uncomfortable in a lot of clothes, he's sweating. So these small little observations are very much required in infants. And also if you are putting a pillow beside, so he likes to getting more thick pillow beneath his head, or he likes without to sleep without pillow. So that's the sign you have to see whether he's more comfortable or he's more into discomfort. So these little things are very, very marked in observation of the babies. Next, in the cradle, suppose you're picking it up, the baby, and walking down slowly or fast. So you have to see how it responds, or even in the slow motion or fast motion, how it lives. And usually what we do, we take the baby in the shoulder, and usually we have the habit to pat. So whether the baby likes to be pat or it doesn't like, that has to be also observed in case taking. Usually what happens when father and mother comes, and either baby is carried by a father or mother, you see how you observe with your eye at the very moment when they enter in your clinic, like how they are patting the babies, or how the baby is, even in the cradle, how they're keeping it to one side then the other. Like even on the during the colic also, if the baby is turned around on the sleeping on abdomen, he's not crying, and as soon as he's turning, as again he's crying. So these little observations are very, very helpful. So you have to find whether in which position is getting relieved, which position is getting aggravated. These all things are very important. Now, even the lights in the closed dark room, they just cry a lot. You need to observe this. Even in the light, what is the reaction in the dark room or light room? Even what you have to see, the water what they drink, which is cold or hot, and even if they are refusing it, and I know after drinking they are coughing it, or they are vomiting it, or it's choking or gagging. So these all little things you need to observe in infant. Now, if you give a baby like something sour and they drink it, you can definitely think of Hipposulf or Pulsatilla. And if the baby react to the door sounds or any little noise which is loud, they aggravates, you can think of borax, you can think of brainia. So there are many remedies. So you have to first observe what is wrong here, why the child is reacting on this. Now, bottle-fed babies usually like their feeds lukewarm, but occasionally an infant refuses the bottle till it is cold. Or another may refuse if it's get a least bit chilled. So individual has their own choices. So you need to see, so this way, this is the way you can find whether he likes more into warm or whether he likes more into chilled. So this is the easiest way. And if present, this is the only way you can actually differentiate, or whatever the like this can actually guide you what remedy has to be given. So this is very simple. Next, child craving of smoked food, like I have already taught about this, Calcarea frost, tuberculum, carcinosin. So, and if the children who are constantly drinking cold water, tuberculum also should be considered the first. And many children, like they imitate their father, like what the father do. If the father don't like vegetables, or he don't like any food, or he has aversion, the child may imitate as a father and follow the same. So you need to see this. Next, the attacks of coughing and belching, how the child is doing. You need to hear it well. You need to see it well. Even the tongue, you need to check what type of tongue is. Is it coated? Is it clean? This has to be observed actually. And the most important, you have to see how the child is approaching. Like even if you have to see the attitude towards you, how they if they cannot see you, or if they cannot tolerate you, they cannot bear to be looked at. That's a rubric also. Cannot bear to be looked at. You can see this behavior with the infants especially, or even to the grown-up children as well. But you need to see what they are doing, how they are reacting. In this I can tell you, the phosphorus babies actually move with the physician's movement. That means what the physician is trying to do, they are very sharp and they are observing what the physician is going to do with me. So they keep on the eye movement here and there, and they keep on observing, okay, this is going to be done with me. This is going. So they are very, very sharp observers of phosphorus, and their eyes move with the movement of the physician, what they are doing. So that's a typical of phosphorus. You can note it. Now, infant feeding. Infant feeding part, an infant's chances of survival is enhanced by breastfeeding. In premature infants, the chance of survival is doubled in breastfed as compared to the artificially fed babies. So that is why we should promote more into breastfeeding rather than more of artificial fed. But nowadays, more mothers are more into artificially fed. There are definitely due other circumstances, but we need to promote more into breastfeeding. Now, let me tell you, the lot of pain in the newborns who are bottle feds, natrum phos is one of the remedy you can think of. Infant oral thrush. The oral thrush, typical borax, is indicated for oral thrush in infants. If you find, and if the child cannot suck the mother's milk and keep on crying, you can watch and you can examine the tongue and you find oral thrush, you can think of borax. Now, infant colics. Infant colics, I'll discuss few important remedies. That is Ilcium anisatum. I don't know if anybody knows about this, but this is something in which the pain goes every 2 hours and comes back. This is a typical of this remedy that is called Ilcium anisatum. And there is a lot of rumbling of gas in the abdomen. And in chamomilla, you can find snarling cry. Infants want to be held, but that doesn't also satisfy. They are very, very agitated. They are more irritated, and they all time they want to do something this and this. The capriciousness also can be seen. So the infants are not at all settled down in doing anything. And what about Sina? Sina, they love to be rocked, even hard rocking. You take this and you keep on rocking them. That is Sina. In colosynth, when you take the baby back in your shoulders and the abdomen get pressed, they feel better. That's lying on abdomen or pressure on the stomach. They feel better. That's colosynth. Pulsatilla babies will have a pitiful crying. Like the cry of pulsatilla child is very, very pathetic one that makes you want to cuddle them and you tell them that everything going to be all right. So they are more what the pulsatilla needs a lot of affection. So they have a habit of absorbing the affection. So you need to see how the baby is crying. Now, the most challenging task is to control a diarrhea of infants. So let me tell you, Jalapa is one of the drug when you are struggling with treating a diarrhea where the mother is complaining the child is passing stools around 15 to 20 times a day, and as soon as even after feeding or the artificial food, the child is constantly doing diarrhea to 15 to 20 times a day. You can definitely think of Jalapa, which is very, very helpful, in which the character of the diarrhea is more into watery, sour smelling, along with the colic. So even the lactose intolerance babies, like who has been asked, the mothers, new mothers who has been asked to stop their feeds and put on artificial fed because your child cannot digest it, this is the first drug to be administered. So Jalapa has that much strong action where it controls diarrhea right away. Croton comes where there is a lot of eruption. Suppose he got diaper dermatitis, and once the diaper dermatitis settle down, again the diarrhea comes. Then again his rashes goes away, diarrhea goes away, then again the rashes come. So these things keep on alternating. You can think of Croton tick is the only one which can help you. Rheum, generally a dentation diarrhea. Even macabre is also used. Sour smelling, little sleep, little fluid. And they are typical of chamomilla-like irritations. You can think of rheum. Rheum babies does not need anything to survive. They need a little amount of food, they need a little amount of water, and they can survive. That's a rheum babies. And typical, very, very irritable. Nothing gonna please them at any no matter whatever you do. Next comes Jatropha. Jatropha is another drug which has been very helpful, in which there is lot of coldness in the body, coldness in whole body, and the stools preceded followed by rumbling and the noises as if the bottle were emptied. So imagine when you empty the bottle, how the sound comes. His diarrhea also will be like this: go, 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 go. So that's Jatropha diarrhea. Okay. Next, infant diarrhea and diaper rash. Infant diarrhea and diaper rash. Borax. The borax is one of the drug which is very, very useful where there is ulcers and soreness around the rectum and candida rashes around the anus, in which diarrheas are also very excoriating diarrhea. You can think of borax. And child screams out in sleep, wakes frightened and clinging. So borax people, they cling a lot with the mothers during sleep as well. Next, diaper rash in chilly babies. You can think of Calcarea carb. In the repertory part, you can find diaper rash of anus, that like more than 10 remedies are also there. Baptisia, borax, bryonia, calichlor, mercor, mercsol, muriatic acid, nitric acid, sulfuric acid, and sulfur. Now, diaper rash where there is excoriation between the buttocks. So there are 15 medicine in this. Carbonium sulf, graphitis, nitric acid, sepia, natramure, berberis, calendula, carvovage, aurum triphyllum, sulfur. So these all drugs are helpful according to the constitutions and the totality of symptoms. So this is just a guiding tool. Now, infant UTIs, what happened when you see the diaper, there is red sand deposit. And the only remedy you can think of that is lycopodium. So lycopodium is one of the most prominent remedy for this red sand urine deposit in the diapers, and where the child is screaming out with pain and kicking all around. Child screams just as the urine begins to pass and ml by flow, and there is red sand deposit. And now what is the difference of sarsaparilla? Sarsaparilla has cries before and during the flow. Cries during and before and during the flow, sarsaparilla, with a gray sandy deposit, not red sand. Now, in infants dealing with infantile jaundice, Myrica cerifera is one of the very important drug you should know. And lupulus, it is given by Bonninghausen. Lupulus, you can read about it. Third, Merck Dulcis. And along with this, there is the rubric also, newborn infants. Collinsonia, Bryonia, Nux vomica, Myrica, Mercsol, Natrum sulf, Elatrium. Now, when to think of Elatrium? Elatrium has to be think where the urine is staining in diaper, in jaundice of infants. That is the drug is Elatrium. Elatrium is also used for malarial cases. Elatrium. Now, how homeopathy can help, like what happens to a newborn when it is born, it is very difficult. Usually nowadays, like when the cesarean section is done, usually what is happening here is the mother cannot feed the baby. So they have to actually pull out the nipples from the syringe, and so that infant can bite. Infant can bite well or hold the nipple very good or suck the nipple, so that only they can secrete milk properly. So, and also for this, you can use calendula compresses after when you pull out the nipples. You can use calendula compresses by using it or applying it directly on the breast. So the soreness of the nipples can be relieved by calendula compresses. Now, Phytolacca 6C or higher is very, very valuable when there is pain radiating from nipple to many other local and constitutional. From nipple, they radiate the pain. And there are many other remedies for breast abscesses also. That is Bryonia, Belladonna, Pyrogenum. And you can think of Calcarea carb and Laccananum also in mastatitis, where there is a lot of pain in the breast. So even for remedies which are helpful for maintaining the lactation, that is Pulsatilla, Calcarea carb, Ginkgo med, Ignitia, and many other remedies. Like lecithinum also, like I taught you, lecithinum is also one of the wonderful drugs for improving the lactation. Next, when you find cases, this is very important when you're treating of infant cases. Okay, the feeding mismanagement. So having considered the diet and the feeding technique is very important. And where you find there is a feeding mismanagement, think of carbo-veg and lycopodium are the most commonly indicated when there is excessive flatulence or flatus. So these either of the one remedy is very, very helpful according to the symptoms. You need to see which has to be given. Now, constipation. Constipation, Illumina is for the constipation for the breastfed infants. So bottle-fed, Natrum Phos, and breastfed, Illumina, according to Dr. Fobister. Also, when all remedies are failed and that constipation is not at all relieving, think of Sorinum. Think of Sorinum, it generally immediately relieves the constipation of the infants. Now, the children, newborn constipations, and they have a stool in a very, very hard lumps. You can think of Entim crude. And now constipation in bottle fed. In bottle fed, there is Illumina as well, Calcarea carb, Nux vomica, opium, and Podophyllum. Now, coryzas, infant coryza. Nux vomica coryza prevents infants from breathing while nursing. So they cannot breathe while nursing due to the coryza. Think of Nux vomica. Even there is other remedy, that is lycopodium. But lycopodium, actually child keeps on rubbing his nose, and they have fan-like motion of LNHI. Also, along with this, child breathes through mouth. The nose gets stopped up, completely blocked. So long-lasting coryza, that is snuffles of infants. Other remedies are like Hippursulf, Sancan, and Sticta P also marked very much. Another remedy you can think of, that is Sambucus, where there is dry coryza of infants, nose completely obstructed, which prevents breathing and nursing both. So even Ammon carb has this, so you do the differentiation accordingly, which has to be given. Now the croup. This is the croup sound I want everyone to listen. So this is a sound, also known as laryngiotracheitis. So croup is a condition is a typically result of a virus such as common cold, adenovirus, or respiratory syncytial virus. When your child has croup, the larynx and the windpipe becomes inflammation. So inflammation and swelling causes to the breathing difficulty. And the remedies, how homeopathy can help, that is the Hippursulfur, Sambucus, Entim tart, Ipecac are the first line of treatment which you can think of. But accordingly, the symptoms in Hippursulf, after the exposure of cold wind, there is rough barking with hoarseness and rattling of mucus. In Sambucus, there is actually he can regular inhale he can inhale good, but sighing during exhalation, and there is lot of profuse sweat that is typical of Sambucus, along with suffocative cough, even fever before with cough before fever. Entim tart, white coated tongue, rattling mucus, croup. Ipecac, clean tongue, and child cough and gags and also suffocates, along with rattling sound which can hurt throughout the room. Think of Ipecac. Now, I know many people might be struggling with infantile eczema, also called as atopic dermatitis. Let me tell you, Morgan Co and Morgan Pure, yes, the bowel nosodes are the skin nosodes which is often required to clear up the infantile eczema. So I'm already done the nosodes workshop, and this week I'm going to teach about the bowel nosodes, the last session, which I'm going to speak about Morgan Co and Morgan Pure. But let me tell you, just for information, and you can read as well, Morgan Co and Morgan Pure are very, very important remedies for infantile eczema. Now, another remedies for croup which can be indicated, that is Calibi. Croup is hoarse, metallic expectoration. In Medorhinum, there is a croup in the babies which gets better by lying on stomach. Now, there is an injury during birth. So what is the first remedy? Arnica, of course. Even arnica is used for infant and mother after difficult labor. Now, for the after effects of the head injury, there are many remedies like arnica, cicuta, hypericum, natrum mure, natrum sulph, and helleborus. So, basis on the history, you need to consider accordingly the remedy. So, let me give you an example. A child, this is a case of difficult birth. A child of 6 years of age took cold very frequently, and he was markedly underweight and had no interest in life, very sensitive to noise, afraid of noise at the high wind, and had other symptoms of natrum sulph. And the history of difficult birth confirmed the choice of natrum sulph, and after natrum sulph, he was rapidly improved mentally and physically, both. So our remedy helps a lot basis of history. So that's why I always ask you to take good history. Now, what do you have to observe in chronic cases? In chronic cases, you need to understand, you need to study the parents, particularly the mother, and you need to question about her pregnancy, its symptoms, what went through, what was the emotional trauma she went through, and there is symptoms of lactation, what had happened, and the baby may need what she needed then. So you need to ask these questions very particularly more into mother history during pregnancy, which is very important in chronic cases. Either you're dealing autism case, or either you're dealing Down syndrome case, either you are dealing with any genetic cases, even in the CHD, congenital heart diseases, or any type of cases, you need to consider the mother history very well. And you need to ask mother typically whether she had any abuse of the drugs during in the pregnancy, or she took a lot of medicine, and after that the baby, when the baby was born later on, because at the very moment you won't find any symptoms in the baby, but when the child is born and after few months you'll get to know and you'll see some symptoms, just because the after effects of the drugs taken during drugs taken by mother during the pregnancy. So suppressed eruption, suppressed sweat, these little informations and the previous medication she was taking. Suppose she's a patient of bipolar and she was just taking her antidepressants, all this in the pregnancy, and the child developing the same things. Like suppose, for example, I'll tell you that the mother is addicted to prednisone, and then in the 4 months, 5 months, and the baby when the baby is born, he has all the symptoms the same, and he has been given prednisone to release that. So this abuse of drugs are very important in the mother history, and after this only you should be ready to prescribe accordingly. So I have kept half an hour for the question answer session, that how to treat and what all conditions you can treat in infants. So thank you so much. Please do share your feedbacks in Instagram and in Telegram, so I can work more and I can provide you more better information, and I can teach you what we can do and how we can do. So I'll take the questions now, and we'll have a discussion about facing difficulties in infants. So whoever wants to ask a question, you raise your hand. I will answer it. I'll allow you to speak and you can answer it. So whoever wants to speak, they can raise up your hand and I'll allow you to speak. Yes. Yes, Dipali. Whoever wants to speak, kindly raise your hands. Or you can write the questions in the chat also, so I can answer it directly. I'm waiting for your questions. I'll answer it directly. No, you type it here itself only, Dipali. I'll right away I'll answer you. Dr. Dipali, you type the question in the chat box itself, in the same discussion box. How to find a constitutional remedy for an infant? You need to see if the child are very fair, flabby, okay, cheeks are red, flushed. You can definitely think of calcarea carb. So that's where you need to see very marasmus, very thin, inverted face, inverted pyramid face, calcarea phos. This way you can see the constitutional picture. So you need to see the build, how the build is. Pneumonia in child, there are many remedies you need to consider it. The first remedy that is phosphorus always, but you need to see. Sir, regarding the potency questions, you can start with always 30 and 200, not more than that. It is generally not required because the immunity is very good. In neonatal cases also, you need to find how the circumstances started with the baby. Then we can think of, accordingly, we can decide the remedy what has to be given. If a child is not responding to anything, you need to see what went wrong and take the mother history. Often parents complain their child not eating properly, not getting adequate. How do we manage it? That's a good question. You need to see what is the constitutional of the child and what the mother history and father history is and their family. If suppose there is a family of asthma, accordingly you have to think of that remedy accordingly. Suppose family history of asthma, family history of tuberculosis, and the child is not gaining weight, you have to give tuberculinum. So then only you can find him improving his diet. So that is very important here. Ear infection in infant due to improper burping. Ear infection, you need to see if he is not able to touch it, you can definitely think of belladonna. If it's more irritable, you can think of chamomilla. And if it's oozing, you can think of hiposulfur. Administer newborns, it's very simple. That's the same way, 100 ml bottle, 1 cap of the solution, and you just pour it on the tongue. That's it. That means you have to give only 2 to 3 ml of the water. That's it. Even in the newborns. And it is not crime to give that. Okay, you can give water, a little amount of water. Dr. Shivani, बच्चों में birth continue lacrimation क्या रहता है? You can think of euphrasia, pulsatilla accordingly when they have continuous. Basically, the first remedy you can think of continuous lacrimation, that is euphrasia. How to administer to breastfed others? It is a myth that you cannot administer medicine or water dose. You can easily give the water dose to the baby. That's what I'm trying to explain. You can give 2 to 3 ml of the medicine on the tongue directly by the cap. That is the water, because you're giving water doses. So it is not at all strong. It's a very minute form and law of minimum. Administered to mother's milk, you can either crush the globules with the sugar of milk and mix in the mother's milk and give them 1 spoon. So you sugar of milk, a pinch of sugar of milk, along with that medicated globules, you mix them and mix in mother's milk and give them 1 spoon or 2 spoons twice a day. Wry neck in child, I would give Rustox or Lecnanthus. Chills suffering from continuously tearing from eyes, Naxwamika. Which context you mention the drug Elatrium? In the diaper, where there is diaper, there is a sedimentation in the urine in the diaper, especially in jaundice cases. In jaundice, suppose the child is suffering from jaundice and he has a deposits in the diaper, staining in the diaper. Then you can think of elatrium. Any more questions? Yes, you can speak Zofit.
Can you hear me? Can you
Yes,
hear
I
me
can
now?
hear you. Yes, I can hear you.
Thank you very much. I've been in a lot of cases that the mother doesn't remember what happened in the pregnancy or the labor after 6 years. What we
Okay.
can do in the situations like that?
You need to figure out like what is the main complaint. Suppose if you're describing this case, what was the main complaint in which you cannot find the history?
There is cases like hyper, like children is not relaxed. There is cases of children not eating well.
So you're talking about more into ADHD children, right?
More what?
ADHD, hyperactive disorder.
Yes, sometimes it's that, yes.
So you need to see the diet correction has to be done. Like sugar should be cut off with the diet first. The diet, in the diet, you should ask them to cut off the sugars, and you need to find mainly the role of vaccinations are also here in these cases. So that has to be figured out. What all vaccines has been given, and along with that, the mother stress during the pregnancy. If you're not able to find out, you need to actually see how healthy was the father mother relationship of the child. So that is more important here. Next.
Thank you.
Yes, if the child vomits the medicine, either you can rub the medicine in the upper lip, that is through olfaction. Okay, so in upper lip you can rub the medicine. Oozing pus from umbilical infant, abrotanum. Melanin problem, vitiligo infants, you need to find if the father is more of a alcoholic or any genetic disposition, you can start from syphilinum. When parents come for immunity booster of the child at time in not see, all our homeopathic medicine improves the immunity. It is not a myth that this medicine is specially all the cell salts or any specific medicine is there to you give and the child will immune power will become very high. That is not the point here. The point is to treat an individual. If suppose the patient is a calcarea carp by the constitution, so calcarea carb only will improve his constitution, not any else other medicine specially, because this medicine is exactly for that particular individual only. So only that medicine can improve his immunity, not any other specifics. For improving mother's milk, lecithinum is one of the drug, and even Ricinus communis 6, even asafoetida. A 6-month-old child always plucking her right ear. What should be the cause? Maybe itching, lot of itching. So you need to find is due to itching or due to anger. First, you need to clarify that. Or you see the face expression. What else? Any more questions? We have 10 minutes left. So what was our homeopathic? So between bedwetting children, how to deal with grinding of teeth? You can think of Sina. Bedwetting children and how to deal. You can think of Sina. So what was a homeopathic approach for suppressed skin eruptions? You need to find out that whether the mother has been used or the child has been used lot of ointments and steroids for their skin complaints. And later on you find you can definitely think of sulfur as the first medicine to be given. That too in a very low form. That means 30, give one dose and wait and observe. Don't repeat frequently, it may aggravate. How often we can repeat in medicine for infants in acute cases? You can repeat as it is required, like you give BD and wait, because our medicine works in nanoseconds in the babies. Like 1 or 2 doses is enough to see the action of the drug, especially in infants I'm talking about. Like you can find straight away within a span of 1 hour, 2 hour, you can see if it's helping or not. Can we decrease the sugar cravings with a medicine specific? Yes, why not? Sugar cravings, you need to find out what he craves. If suppose he craves a lot of chocolate, you give chocolate 201 dose. That's it. Leave it. Even he can have carcinosin. So you need to see accordingly. Even phosphorus. So there are other drugs also. You need to correlate what has to be given by their build and the history. Lactose tolerance in infants, like I told you, there are many medicines, but you need to see what are the symptoms. Like natrum carb is one of the drug, also very marked for lactose tolerance in infants. And like I explained you, jalapa, if he has lot of diarrhea, even lot of if he's taking milk and he has lot of flatulence, and even he's burping a lot and still is not getting relief, you can also think of China. How to deal with convulsions in neonatal? Definitely, you have to see how the baby is doing. If the fist is clenched, you can think of cuprum, cicuta, and you have to see the history whether he got any injury. The first drug you can think of, that is natrum sulf. If suppose after the birth he has get convulsions, or after a head injury he got convulsions, the first remedy can be think of natrum sulf. And you need to see if he's getting cyanosis of the lips and convulsions, you can think of cuprum met. And if cuprum met fails, think of cuprum sulf. In that cases where there is a cyanosis of the lips and he's getting convulsions, even in fever of 101 also he gets convulsions, you can think of cuprum sulf where there is cyanosis and clenching of the fist and thumbs. So when a child is so shy in the first meeting, always when calcarea carb, Brighta carb, Dr. Ankita. How do you manage SAM cases if your diet chart? I'll definitely share you. Water dose when 200 potency use, what should be interval with the repetition? That's what I'm telling. Either BD or TDS, depends upon the need of the baby. You see the symptoms getting settled down, either make it OD also. So infants don't need repetition of stimulation. In the 3 dose, 4 doses, 5 doses, they are perfectly well. So in cases of child where the only symptoms coryza throughout the no dressing, what can be thought of? You can think of lycopodium. Chronic coryza cases of infants. Lycopodium. And they are very thin also. And if they are in a calcarea carb constitution, give calcarea carb. Simple. It's very simple. See, I had cases of twin. They both are calcarea carb like child, and they had chronic coryza. I gave both the babies calcarea carb, and within next day the coryza went off like magic. So that is the power of constitutional. Fail to thrive, even more not getting more appetite, not eating well. Child of 2.5 years old, late learning to talk. He has retention of cyst in his mouth and the tongue since birth. No symptoms yet. Is Silesia 6S BD given very extra type? I didn't get it. Retention of cyst in his mouth. He's late learning to talk. Retention of cyst in his mouth. Do you have the picture? If I can post the picture and the case with along with mother and family history, I can help you. You post in this group only. This whole group has been formed just to help each other. That's the motto here. So we have all our team. Everyone is competent enough. Everyone can help each other. This is the reason we have formed this team. Ankita, in hyperactive child, you can think of in what context you're asking me in a hyperactive child? Mostly if given antibiotics, yes, it becomes an obstacle. Hemangioma in most tumoring child. Okay, calcarea floor is the first drug to be thought of. And I have treated with calcarea floor also arnica. Next. Yes. Acha, touching things on table, running inside clinic. Tuberculinum and tarantula. Those two remedy only you differentiate, you will find it. Can homeopathy help in autism? Only homeopathy is the answer for autism, along with occupational therapy. Yes, homeopathy is the answer for autism. A child of 2 years having diarrhea since 5 to carrot, curdled yellow stool, causation taking chips, kurkure, thirstless. I gave pulse, no effect. China 30, no effect. What can be done? Are you sure it's due to chips or anyone else, any other person is also sick in the house? Monica? Intolerance in eggs for babies should be considered even if it will be avoided. He used to get skin rashes. You can think of calcarea carb immediately, where there is the desire and there is aversion both. And Dr. Monica, tell me if somebody else also sick or only the child is sick because it's been 5 to 6 days. Mother milk cause diarrhea, constipation. Bottle fed constipation, diarrhea. Huh? Acha, mother milk cause diarrhea, jalapa. Mother milk causes constipation, alumina. Bottle fed constipation, there is alumina as well as natrum phos. Alumina along with nux vomica for bottle fed constipation. And diarrhea, you can think of podophyllum, very well acted for bottle fed babies. Monica, is the child only suffering or someone else also suffering with diarrhea? Acha, he takes kurkure and chip all the time. You can think of calcarea phos. Let me know after giving calcarea phos. He needs crunchy things. That's calcarea phos and tuberculinum. How to treat a child having teeth brittle, white plaque, later on it turns to yellow, the tooth decay gradual process, even taking proper hygiene. You can definitely think of nosode in this case because he really needs a nosode to clear up. Get the family history well, or you post a case over here. Will help. Okay, I told you, Monica, what has to be given. Mother milk cause diarrhea, you can think of jalapa. Constipation, bottle fed, you can think of alumina, nux vomica, calcarea carb accordingly. But constipation by breastfed, you can think of alumina. So there's a difference, bottle fed and breastfed. So bottle fed is more into this alumina, nux vomica, calcarea carb, and breastfed you can think of alumina only. Definitely you think of phosphorus if the child is lean thin and likes fruit. And you can also think of calcarea phos here, better Kadambari. He likes fruit, he's lean thin and delayed dentation, calcarea phos, not phosphorus. Hyperatium child does not sleep till cry, repeats what others spit on person, like to roam, lean thin speaking. Divya, you can think of cyperidium once. And I would need a history. So definitely giving cyperidium, he'll start sleeping. And if it doesn't help, then we'll think of serotonin. So I need case details more about this child. But right now, you can give cyperidium. Erythema toxicum needs treatment. Yes, if it's really required. If having difficulty, definitely you should. Generally, Rustox can be the first drug to be think of. Autism cases can be treated to what children? See any, like you have to see what is the current state, and because what happens here, early stages of autism cases responds very well with homeopathy, and even the older child also responds, but that the same skills what you expect to grow, that won't come back at the older children of autistic. But the children who are very young, they can definitely improve and go to a normal school. That can be happen. Yes, especially for the mild autistic, definitely they can study in a normal school, the mild autistic children. But you should treat them accordingly with the medicines. So coldness of souls even during summer season need to be soaked always and kid. Think of Cilicia. Any more else? We shall wrap.
Sir,
Thank you
before
so
we
much. Yes,
can I have one question, please?
yes, please.
The child, who is born like very clean, and within 2-3 months he gets too many hair, like especially like mustaches. So what does it indicate? Like it's meadow or
Yes, medorinum could be the possibility. You need to see the family history.
the child was born like cesarean and it came before time,
That's
and
premature delivery. Yes,
the
yes.
mother had difficulty like during pregnancy. So I was thinking whether it will be thyroidinum or it will be, and
Maybe
he
you need
had
to see accordingly.
jaundice soon after the birth.
Thyroidinum will be the first choice.
Okay,
Yes. Jaundice soon after birth, thyroidinum first.
thank you.
And later on if they have any issues. So what we can observe in autistic child, main point, you need to see the behavior patterns and what things triggers them, what shit doesn't, and also the mother history of pregnancy. That is very much important. What medicine can be thought of psoriasis of child and palms on both hands? It is not about the psoriasis, it's about the discharge and it's about the aggravation and amelioration in psoriasis. Then we can only help him. So blindly, I can say any drug, calcarea, carb, graphitis, sulfur, like this I can suggest. But if you want me to suggest the right drug, please send me the case. Then we can think of any particular individual drug. So only antibiotics can use corticosteroid or other antitussive. Antiemetics are just use antitussive, like all the cough syrups and the laxatives are definitely obstacles in our case also because but it has a more of palliating effect if taking one or twice. But abusing it becomes an obstacle in our cases. If a child has had a hand injury, she's bandaged in the head and she's dancing and all. That then definitely tarantula. Eruption in skin and hand be itching during summer season, itching only during summer season in child. More details needed, Razina, but still you can give sulfur 1 dose. Spongia and Drosera child cough. Spongia cough is more like drilling into the saw pine wood. If you drill, that's a complete barking cough of spongia. Okay, and in Drosera, as soon as the child sleeps, he starts coughing, maybe gagging, maybe he go to the vomit phase, but more of dry. And Drosera, they are more into jealousy kind of. They compare also. Those children are more hyper towards their relationships in Drosera. But spongia are chronic dry cough, and spongia cough aggravates by sweets. Spongia cough aggravates by sweets. That is a marked symptom of spongia. 5-year child having vacuum delivery, fear of dark insects during the daytime and fear of being alone in room, clinging, teeth brittle, decay, upper tooth, develop corn on right lingual finger, okay. Crack with slight bleeding accusingly. Delivery, fear of dark insects. You can think of how's the build, Dr. Shraddha, of this child, which case you have sent me. How's the build of the child? Lean thin. Okay. Lean thin and fear of dark insects during the day, being around, clinging, teeth decay, develop corn and crack, slight bleed. And how's the behavior of the child? That is you need to share me. Share me the behavior of the child. This is very little information which you are provided he has more complaints and very little information. Small red spot on the palm, sensation as if they cut in the hand. Sensation of cutting in the hands were more of marked of you can think of merc or nitric acid, but that is not enough here to indicate with only one small symptoms of red spots. Find out how it started. CC lane thin. Okay. As retention of cysts was told by ENT patient that will absorbed by Boston or no, and no even these animal hypoplasia. This is a case, I think, more of Dr. Madhuri. I feel that this case is more of syphilitic. I need father and mother history as well. Calphos. And outside, very calm and shy, less confident but little very at home. But outside is very calm and shy and less about the whole little aggressive. Okay, then you can think of 1 second. You can think of CP then. Okay, if it still doesn't help, then post me the complete case with mother and father history. Okay, if I'm losing the thread here. Okay, if the jaundice soon near birth, what potency can be 30? Can we see aggravation of the physical and mental if the medicine is wrong? No, nothing. We see nothing. If you give water doses, as I have instructed, as Hahnemann has instructed, if you give water doses, it won't. Very, very less or minimal. So, call it a day. Thank you so much. I would request everyone to share your feedbacks everywhere, Instagram or Telegram, wherever you want to share. Please do share. And I'm really grateful that you people are so keen to love, and you have so much desperate that how to be a better physician. That shows me a right way that yes, we can all together do it, and it encourages me to have more sessions like this. And this was only for infants, and very soon I'll come with only pediatrics case taking and approaches. So that's way we can do it, and more of constitutional approaches, not just only giving medicines blindly. See the constitution, how the child is. So I'll come up with this very soon. And thank you so much. Thank you. Thanks a lot.